So welcome to the first of what I hope is going to be a number of discussions amongst the Asia News Network editors. For those of you who don't know the Asia News Network, it's a group of media organizations across Asia, and in these discussions we want to talk about the current crisis, the COVID-19, the coronavirus that is of course affecting all of us. Before I start though, I would like to introduce everyone who's here. Maybe I can ask you to go round one by one. We have representatives here from China with Jolie, who's sitting next to me in Hong Kong. We have a managing editor from the Jakarta-Post. We have the digital editor from the Star in Malaysia. And we have the executive director of the Asia News Network in Thailand. And we're going to start this, as I said, as one of what we hope to be a series of conversations with some of the editors over the next few weeks as things develop. So let me start with Jolie, who's sitting to my left here. Maybe you could give a quick introduction to yourself and tell us a little bit about the situation in China as it stands right now.
Hi, this is Jolie. I'm the Deputy Editor-in-Chief of China Daily. The situation in China now is almost under control, with the new cases slowing down, and the life and work could be back to normal. According to the schedule, by tomorrow, the Wuhan, the epicenter of the outbreak, could be released from the lockdown, and so things are getting better. But now the country is facing two challenges, and one is the importation of the infections, and also the possible recurrence of other infections in their countries. The other challenge is how to resume the activities of economic activities and productions in the meantime.
Okay, and we're talking to you from Hong Kong. That's where we're based here, where we're in the second wave, as they're saying. Yeah. The first wave, we almost had it under control, and now a lot of returnees and more problems coming in. But let's move over to Indonesia, where we have, and let me, I'm sorry if I'm getting your names not quite right, Evie Mariani, who is...
Effie.
Okay.
Effie Mariani.
Tell us a little bit about what's happening in Jakarta and over in Indonesia.
Okay, it's Indonesia is now as opposed to China. We have the situation almost out of control. We have Jakarta and East Java now as the epicenter of the virus. Jakarta is the worst. Greater Jakarta is Jakarta or Greater Jakarta is the worst. And now the virus is already spreading to almost all 34 provinces in Indonesia. And the data from the government doesn't really reflect the real situation on the ground, because just recently even the government admitted that the official data they report every day, which is about less than 2,000 cases and about almost 200 deaths, are actually not really accurate. So we believe that there are much more of the cases going under the radar.
Okay, let's switch over to Malaysia now with Philip Galingai. Am I saying your name right again? Known Philip a long time. Philip, you're a digital editor at the Star, based in Kuala Lumpur. What is the situation where you are right now?
We are on our 20th day of our movement control order. And then so far, as of yesterday, we had around 3,660 cases and then 61 deaths. And then on Friday, the government will decide on whether to extend the MCO or end it. So yeah, we're waiting. And then the new normal now is to stay at home.
Okay. And over in Thailand, Panna, maybe you can give us a quick update on what's happening there, and a quick introduction as well, of course.
As far as Thailand is concerned, Thailand is about on the same curve as Malaysia. The number of infected is 2,220, plus 26 deaths. The government has now announced and introduced a curfew in the evening, and each province is now affected, but most of the provinces are 1 or 2 cases. The big cases are in Bangkok, in Phuket, in Chiang Mai, the bigger urban cities. Now they encourage people to stay at home. The issue is for us is more of both balancing the economy and the infection. Partly because most of the low-income people, they work on the street, they sell food, they sell things on the street. If you shut down the entire economy, then there will be other issues that we have to face.
Okay, thank you, Panna. Now, one of the things that I want to talk about or want to ask you is about how do you control it? How do you think, which kind of measures do you think we should be taking? Are they region specific, or should they be the same wherever you are? Maybe we could start with Jolie to talk about China, because China's really been through this, has had some very strict measures, some would say quite draconian. At first, I think a lot of people were saying, you know, this is really very, very strict. How can you do this? But now others are taking that on. Maybe you could start with telling us a little bit about that, and then we can move over to the rest of you to try and get your opinions on what we should be doing right now, what you think is working in your countries and what is not.
Well, yeah. Well, there's a lot of summaries online about the China's practice. And one of the most important things is to act quickly to isolate the infections from the other peoples. And we summarized it into 4+4. So the first 4 refers to earlier steps, 4 earlier steps taken, earlier detection and earlier detection, early reporting, earlier isolation, and earlier treatment. And these 4 steps should be targeting 4 groups of people, which means the confirmed patients, the suspects of being infected, and also the people who are having fevers, and also the close contacts with the infected. So there's 4 groups of people, and put them into different places. Suppose the confirmed patients should be put into the designated hospitals, and also those other people like suspects and those having fevers but not confirmed yet should be put into the temporary hospital, which was repurposed from the stadiums, sports stadiums, and also exhibition halls. As for others that have some suspicion of being in contact with those infected, those people will be put into some designated hotels and also schools, training schools, training centers for quarantine.
Evie, Indonesia has one of the highest death rates, I think, in terms of this current climate. Things are changing, of course, all the time. What measures are you taking in Indonesia, and what do you think is working, and what do you think needs to be strengthened or changed, if anything?
Yeah, I think I can talk more about what is not working. Indonesia, I'm going to be very blunt. I think Indonesia is not in a good situation right now because, as you said, like early detection, act quickly. We did not do that at all. We lost 2 months. The health minister said that like our prayer will save us, and Indonesia's hot climate will beat the virus. And just recently they repeat that narrative again, even though it's clearly for the WHO is sorry, can you hear me? Oh, okay.
Yeah, we're
Okay.
Loud and clear.
It's clearly for the WHO, it's a myth, right? Like hot climate. But what is happening right now is in Indonesia is first, we were late about 2 months. And second, up until now, we haven't done anything except for what the government called large-scale social restriction, which is a version of social physical distancing. But there's not much restriction. So until this morning, we still see a lot of pictures from people on the street, like really getting crowded. Even last week, one top official and a police official had a large wedding in a hotel. Even though the police themselves, they arrested people for having a crowd, but they themselves, they're having a wedding party. It's like one of the top official in the police in West Jakarta. So we are not doing, we don't do lockdown. The president is very adamant not to do lockdown. No lockdown, no lockdown, no lockdown. And even the large scale restriction is has to be like undergoing a red tape. This is what our front page today talking about. The Jakarta governor asked for, like, has to ask, and there's a bureaucracy for the central government to say, yes, you can do large scale social restrictions. So we've been doing, you can say we've been doing not very much except for calls for people to stay at home. I'm working from home right now. It's been already more than 2 weeks, but otherwise no early detection, no early quarantine, no early isolation, no lockdown, no quarantine, whatever. Almost nothing right now. So we are like in a situation where maybe the health minister was right in the first place when he said it in January that we should pray right now.
Okay, let's move over to Malaysia. You have some of the highest testing rates in the region. Do you feel that testing is one of the things that really is helping, or is that just, are there lots more measures that you need to be taking?
The testing is working because we are finding out who is positive and who's negative. But I think technically we have a partial lockdown, which is very good because it stops movement of people. And what we have is not a total lockdown like China. The head of the house can go out within 10 km of radius to go out to buy food or to go look for medicine. So roughly, we are still allowed to move around. It's just that we are restricted, and technically we have a curfew. We can't move from 8 p.m. till 8 a.m. So Malaysia is a loose kind of lockdown, and I think it's working because when you look at the statistic, we are flattening the curve. But then our health ministry on Friday will decide whether we'll extend it or not. So we'll know on Friday whether our measure is working.
And Panna, in Thailand, obviously Bangkok is known as a real travel hub. Do you think the restrictions on travel, again, is something that is working well? Or, I mean, as I said, and again, maybe more openly talk a little bit about the measures that you're taking there in Thailand and what is working and what is not.
Yes, in comparison, we are between Malaysia and Indonesia in terms of efficiency. The government has announced several measures, but quite loosely. So it allows movement. We can still go to work, but at night we stay home. The issue is more of the ability. The Thais, like the Indonesian, unless you discipline them, they will get loose. They cannot stay put. They need the movement. They need freedom. So the communication from the leaders are key to the success of keeping people away. We in the last government, we have a military government, and this is elected government is a continuation of that military government. The prime minister is a former army commander. But he deployed the bureaucrats in carrying out several of the measures that to limit movement of people. The Thai bureaucracy are not that efficient, but on the good side is that we have quite strong primary health care. So in the provinces, in the district, and in the towns, there are clinics, there are people who can advise. So this part helps a lot. That's why you see that even though all the provinces in Thailand are affected, most of the provinces only have 1 or 2 cases, and then they spread out the treatment of the patient. So we are moving along the curve, and as you said, Thailand is a travel hub, so we have a lot of imported cases. In Phuket, there is 100 cases of infections. 20-30% are foreigners. Similar in Bangkok as well, and all import cases, including Thai students who came back, when the UK school was shut off, and so on. So I think April for most of the Asian countries, including Thailand, Malaysia, Indonesia, and so on, April is a crucial month. If we can hang on and then reach the peak during sometime this month, things should get better. This is my assessment.
Okay, and that leads me actually to my final question. Really trying to figure out where you think this is going to go. How long of a lockdown can we take, or can the economy take, should I say? But also, what are your predictions? What do you think is the likely outcome in your country going forward? I know it's a very difficult thing to put on the line, but I think at the moment everyone is looking to try to figure out what's going to happen next. Maybe I can start for China. I talked to friends in China just last week. They were saying things are getting back to normal again.
Well, yeah, most of the places things are getting to normal, and but with some special attention paid to the symptom cases. I mean, those symptom-free cases, which will pose the potential risk to have a second wave. So I think the lockdown will be, well, in Wuhan's case, it's almost 3 months, and but I mean, the economic toll is huge.
Yes.
I mean, especially as the trade and the business came to a halt, due to the massive shutdown.
Yeah. Well, from our office here, we can look out the window and see ships going past, cargo ships going past through the Aberdeen Channel, which feeds 3 of the largest ports in the world. Firstly, a lot less ships going past, and then some of them, really half empty. When you look at them, they seem like they're missing what they would normally be carrying. What do you think in Indonesia, Evie? What's your prediction in terms of time? How long will it take for this to pass? As you said, at the moment, there's a lot of criticism of what the government is doing about it. Does that mean it's going to be prolonged, do you think?
Yeah, there's many predictions. Even the spy agency, the intelligence agency in Indonesia, predicted that this is going to get worse and worse until July. And before July, we have Idul Fitri, Ramadan, we call it Mudik. It's exodus to hometowns. And the government hasn't banned people from traveling to hometowns. So there will be an influx of people going from the epicenter of the virus to their hometowns, mostly in Java. So we're going to maybe it's safe to predict that it's probably going to get worse in Java, outside Greater Jakarta. And we don't have, our healthcare system is already kind of fragile right now. We have dozens and dozens of nurses and doctors already died. Some of them are confirmed positive of COVID-19. And so, yes, I think the inaction has caused Indonesia a prolonged outbreak. I hope I'm wrong. I really hope I'm not right. But I think a lot of scientists publishing their modeling, and yes, it's going to be long. It's going to be like people we go hometowns on the Ramadan. I don't know whether in Malaysia the government is already like banned traveling home or not, but in Indonesia it's not. So yes, impact on the economy, of course, everywhere in the world, right? But we also face a lot of uncertainty. Of course, we cannot really predict what's going to happen. But because there's been a lot of negativity coming out of my mouth so far, so I'm going to like maybe say something positive, at least in the absence of the government measures, like strict firm measures. We see that a lot of people helping each other, especially because Indonesia has a big informal sector, like the motorcycle taxis and then street vendors who lost their income for the past 2 and 3 weeks because of the social distancing restriction, right? So we have seen a lot of generosity from the citizens, and also doctors and nurses, they cry out asking for protective equipment, because we're like China also helping. Thank you, China's government. But also the citizens themselves, they devise homemade mask and then homemade face shield, homemade disinfectant chamber. Well, you can debate the effectiveness, but at least people are trying to help each other. It's like really something that I'm kind of like, okay, maybe the economy will break down, but humanity, I think, will stay, I hope.
And Philip, for you in Malaysia, where do you think it's going to go for you?
I think in Malaysia, it depends on whether we flatten the curve, but I think what we'll have is in the next few weeks, we will loosen the restriction. They will allow certain businesses to go on. But for me, I'm quite positive about what's going to happen next, because for me yes, we need to sacrifice, and then most probably our economy will tank a bit, but in the end we will prevail. I'm very sure of that. So yeah, we should be okay. And then in terms of Ramadan, as my colleague from Indonesia mentioned, we have not decided yet, because for us we will look at the trend on what's happening. If it depends on what the numbers tell us. If the numbers are good, then maybe they will loosen up a bit and they'll decide on Ramadan and whether they can go, they call it balik kampung, they can go back. And then just to add into that, the humanity part, the one thing great about this, not say great, but one thing great that has happened with all these challenges is the act of kindness among Malaysians. Malaysians, although they're told to do social distancing, but they're very close in terms of on social media. They are helping each other. For example, like if they know this community do not have food, the other community will help. So yes, it's a very challenging moment for Malaysia, but it has exposed our kindness in us.
And thank you, Philip. And finally over to you, Panna, in Thailand. How long do you think this is going to last?
Well, hopefully I think we will see further restriction, and maybe this month or the next we will peak, and then things start to improve. The issue will be the economy. In the first quarter already, the growth was already -5. Five is a lot. If you go into the street today, most of the traffic jams are from cars, are from delivery motorcycles, delivery food, delivery e-commerce. So that's a growth area that is replacing the normal retail shops. So the economy could change forever. And I think if I can quote Dr. Mahathir, he was speaking this morning that all of us, we have to accept lower incomes, because the overall economy you will earn less, so you will spend less, and so you will enjoy less. So I think overall we will see much more hardship, and the hardship will come with more crimes and so on. So the picture is very mixed, but more on the negative side.
Okay, thank you very much for your time. I know you're all very busy at this point. Of course, journalists, although you're working from home, still have a lot of work to do. I'm hoping this is going to be the first of a number of discussions we have across Asia with our editors from the Asia News Network. My name's DJ Clark from Hong Kong. Thank you all for joining us. And as I said, I hope we'll talk again very soon.
Okay.